be your nurse for today.
My name's Sam. I'll be your aide.
Okay. So I see that you were admitted from the emergency room today, and we're thinking most likely with frostbite. It's important to act quickly in these kind of situations, so I'm going to go ahead and get my assessment started, and Sammy's going to go ahead and get your vitals, okay? First of all, can you tell me where you're at right now?
I'm at home with my daughter here, Catherine.
Oh, okay. You're actually at St. Elizabeth's Hospital in Boardman right now. You're not at, you're at the hospital.
Oh.
Can you tell me your name?
I'm Ethel Baker.
And can you tell me what year it is?
I think it's 1975.
It's actually 2015. But I'm going to go ahead and start listening to your lungs and your...
My mom has Alzheimer's disease, and she was, like, the latest doctor's appointment, they said it was at stage 5, just so you know.
Oh, okay.
Her blood pressure was 92/60. Okay, I'm going to get your temperature.
Okay. And while she's doing that, I'm going to go ahead and listen. And start.
Pulse is 120 and 97.5 is your temperature.
Okay. Can you feel any of that? Can you feel?
I can't feel there, no. Back when you touched my ankles a little bit, I felt it a little bit.
Okay. Now, what do your feet feel like right now?
Right now, they're numb, but before they felt all pins and needles in there.
Just in your feet, or was it anywhere else?
Just my feet.
Just your feet. All right. Well, can you tell me what happened today? How you got here?
Well, I don't really remember, but Catherine brought me here.
Well, what
in the car.
happened was I left to go get groceries just for 20 minutes and left my mom at home, which usually she's okay to be at home for a little bit at least. And I came back and she was gone, so I drove around the neighborhood and found her 6 blocks from home laying on the ground in the middle of the park.
Okay, well, I do understand that could be really frustrating to just leave for only 20 minutes. But with Alzheimer's, and especially such a high stage that she's in at the moment, stage 5, those kind of things could happen. And also another risk factor with a high level of Alzheimer's like this is frostbite. Especially once, you're at the stage 5, it's sometimes hard to even remember what kind of clothes are appropriate for the weather being so cold and snowy out, so.
Where's George at, Catherine?
He's on his way, Mom. I told you that.
Oh, okay.
All right, so I wrapped up my assessment, and I just saw Dr. Joe passing out in the hallway, so I'm going to go ahead and go let him know the results of my assessment, and we'll definitely figure out what's going on here. And as I'm walking down the hallway, I'll check to see if I see George for you, okay? But in the meantime, do you need anything? Is there anything I could get for you?
Just George.
Oh, okay. Well, if you do need anything, here's your call light. You can just hit this red button, okay?
Okay.
But if not,
Thank
I'll be
you.
back in shortly to check on you, okay?
Thanks, honey.
Thanks. All right. Oh, look who I found.
George.
Oh, hey, Ethel.
Hi, Dad.
It took you forever to get here.
Here, you can sit down.
Thank you. Oh, how are you, sweetie?
Good. I'm taking care of a patient in room 1 that was newly admitted with frostbite. We're thinking most likely frostbite. And I just wanted to let you know my assessment results and what you think exactly we should do with her. The patient's daughter found Ethel Baker in the park. She was really confused. The patient has stage 5 Alzheimer's disease, according to the patient's daughter. I'm not feeling her posterior tibial or dorsalis pedis pulses in either of her feet. but I was able to find the pulses using a Doppler, but they're both very weak. The patient states that she has pain. She was having pain and tingling in both of her feet, but they are now numb currently. Both of her feet are white and waxy and hard to the touch. The rest of her assessment was good. Heart sounds were good, lung sounds clear bilaterally.
Okay.
Everything else was pretty good, just
Yep.
her feet.
Yeah, that definitely sounds like frostbite to me. My plan is to start rewarming process immediately. We need to get her feet in circulating bath water around 100 to 104 degrees Fahrenheit. We're going to do that for roughly about 30 minutes and we can reassess her.
Okay.
Is that okay?
Yeah, sounds good.
Depending on what we find, we can repeat the procedure if necessary.
Okay.
She'll be in pain, but be sure to assess her pain level frequently. Okay?
All right, sure.
I'll put an order in now for 600 milligrams of ibuprofen to decrease inflammation. In the meantime, we can get labs done to check her potassium level and
Okay.
also hook her up to an EKG.
All right, sure.
I want you to start an IV of 0.9 normal saline at 100 per hour. I'll also put an order in for 1 milligram of morphine for pain. Go ahead and ask her last about her tetanus shot. If she hasn't had one in the last 10 years, we should give her one for prophylactic measures.
Okay.
Also, I'm ordering TPA injections.
Okay. I've never heard of TPA though for frostbite patients. What does it do?
TPA is shown to be really helpful in preventing amputations from frostbite injuries.
Oh,
It helps restore the blood flow. Let me know how she's doing after the first 30 minutes of rewarming, and we'll assess her. We'll go from there.
Come in. Hello. Hi. George is here.
Aw,
Hello. Hi, George.
Nice to see you again.
Hi, Ethel. I'm Joe. I'm your attending physician today. I just came in to check up on you. Looks like you got some pretty severe frostbite. I'm just gonna feel up your pulses while she gets your medications ready. Okay?
Okay. What kind of medicine am I gonna take?
I have some ibuprofen here for ya. We're also going to be doing a whirlpool here on your feet too. So here's your ibuprofen. Here's some water. This will help with some swelling.
Can you move your feet for me?
That's your oxygen.
It's blowing at me.
Yeah, it stays in your nose. It's giving you
Oh.
oxygen through
Okay.
that tube, okay?
Okay.
Okay, Ethel.
You
I
know
just came to
best.
check up on you. I'll be back in. I wrote some orders for you.
Okay.
Okay. Take care.
Thank you, doctor.
Okay, I'm going to go ahead and get an IV started on you, okay? This way, we're going to be getting some fluids into you. Now, what hand do you use? Are you right-handed, left-handed?
Right.
You're right-handed?
Yeah.
Okay.
You're left-handed.
Ethel, you're an old lefty.
Left. Left.
Okay, you
Yeah.
use your left hand?
Yeah,
Okay.
left.
All right, then I'm going to go ahead. I'm going to use your right arm then.
Oh, okay.
Okay?
Is it gonna hurt really bad?
It'll just be a quick little pinch.
Okay.
That's all. This is 0.9% normal saline. So we'll get some of your blood volume back here, get some fluid going into you. Okay. Okay, quick pinch. All right, all done. Very good. You can just relax your arm now. Okay, now I have this TPA. This medication is going to help you. It's an injection I'm going to put through your IV first before I hook you up there. And this is going to help blood flow return back to your feet where that frostbite is. Okay? 'Cause
Okay.
that's the biggest thing we want to do is get that blood flow back into your feet. All right. So this is your TPA. Okay, very good. Go ahead and hook you up here. All right, the next thing I'm going to go ahead and get started on ya is going to be a wash for your feet. And what that's going to do, it's going to help your feet kind of warm them back up a little bit for you here, okay? Okay, Ethel, I'm going to help you come scooch up here because I'm going to bring your whirlpool bath over to the side here. And we're going to be able to put your feet right in there, okay? All right. You okay? Okay. All right. So I'm going to put this down here and just put this one foot. There you go. Eventually you may feel some pain. I know your feet are numb right now. This water is very hot. It's like 100 to 104 degrees, so it's pretty warm. And I'll be coming back in shortly to reassess your pain to see if you're feeling any tinglies or pricklies in your feet or anything like that.
How long does she have to do that?
About 30 minutes. About 30 minutes, and then I'll come back in and reassess for her. But I do have one more question for you. Have you had a tetanus shot recently, or do you remember the last time you had a tetanus shot?
I really don't remember. Sorry, honey.
Why does that even matter?
Actually, I remember when. The year was 1970. It was the summer. It was the year our Catherine was born. Do you remember that?
I remember Catherine being born like it was yesterday.
Yes, Nixon was just voted into office, I believe. We were out in the garden working, and she stepped on a rusty nail, and we came to the doctor, and she got a tetanus shot. Is that still good? Will that work?
We're going to have to get a new one.
So why does she even need the tetanus shot, though?
Well, the tetanus, what that's going to do is prevent any infection that could occur. So it's just a prophylactic measure, just to make sure that she doesn't get any sort of an infection.
Oh, okay.
Okay. Do you have any other questions, or is there anything else I could get for you?
Ow! Ow! It
What's
hurts.
the matter, Mom?
It hurts.
Well, press that button that she gave you, that nurse gave you. She'll be in here.
Ow.
Oh, here she comes.
Ow. Ow.
Is everything okay
Ow.
in here?
No, I'm in really bad pain. It hurts so bad. Please.
All right.
Please.
Okay. Well, that's just a sign that the rewarming process is working because you're getting some sensation back in your feet, okay? Sometimes this could be really painful, but the doctor has morphine ordered for you. So on a scale of 0 to 10, what would you say your pain is right now?
A 20. I am
20.
D-O-N-E. Done. I want out of here. I want to go home. I'm done.
Okay, well, we're going to get you some morphine, and hopefully that'll help you, okay? Okay, Ethel, I have your morphine here for you. So hopefully this should help with some of the pain, okay?
I hope.
All right.
Well, if she's in so much pain, why do we have to use these stupid baths? Can't we just put a heating pad on it or massage her feet or something?
I do understand your frustration, but this is a standard process of rewarming frostbitten toes, or anything really that's frostbitten. It's contraindicated to use dry heat with frostbite because the skin is numb, and the dry heat can burn the skin really, really easily. So it's important to not use dry heat, and it's also very important not to massage the area that's frostbitten.
Okay, whatever. It just seems like the hospital's trying to get money off of us or something.
Oh, no, we would never do that intentionally. We're just trying to help your mom out and get her better and help reverse this frostbite, okay?
Okay.
All right. Well, let us know if you need anything. I'll be back in shortly to check to see if your pain's any better, okay?
Thank you.
All right. You're
Thanks.
welcome.
20 minutes later.
Hello.
Hi.
How are we doing in here? It seems like you're doing a little bit better.
I feel so much better. Thank you.
Oh, very good. What's your pain now on a scale of 0 to 10?
Probably just a 1.
Okay, very good. So since our 30 minutes is up, I'm going to go ahead and take your feet out of the bath here, and we'll go ahead and I'll reassess your feet. Okay, oh, very good.
Wow, they're red.
Yeah, they're red. That's a really good sign. I can feel all the pulses, too. Very good. Much improvement. Very good job. So I'm going to go ahead, since our rewarming process is over, your pain is under control, I'm going to go ahead and find Dr. Joe and let him know our results. Let him know that the rewarming process was successful, okay? Is there anything I could get you in the meantime?
I don't think so.
Okay, I'll be back. Hey, Dr. Joe, how are you?
Good. How's Ethel doing?
Good, she's doing much better. The rewarming process definitely worked. So all of her lower extremity pulses are moderate at 2+. on both of her legs bilaterally. Both of her feet are reddened, which is also a good sign. So I ended up stopping the whirlpool. Is there anything else you wanted me to do?
That's good. I'm glad it worked first time around. Now I'd like to order the IV antibiotic. We're going to go with 1 milligram of cefazolin IV and 100 milliliters of D5W.
Okay.
We're going to infuse that over 1 hour.
Okay.
While you're in there, go ahead and put a sterile dressing on her feet, in between her toes. Remember to keep her feet elevated. We want to promote the circulation.
Okay.
We're going to go ahead and admit her overnight now because I want to get an MRI and a bone scan in the morning.
Okay.
I would like to see how much of the tissue is viable.
Okay.
So it looks like everything should be fine and she won't need an amputation, but I would like to be sure.
All right.
Okay.
Sounds good.
Sounds good. I'll go ahead and put that order in for the antibiotic.
Okay. So I'm going to go ahead, I'll hang the 1 gram of cefazolin IV and 100 mLs of D5W over an hour. And I'll go ahead and apply that sterile dressing to her feet and in between her toes.
Sounds good. Just elevate them while you're in there.
Okay. All right. Sounds good.
Thank you.
Thank you.
Come in.
Hello. Okay, so I talked to Dr. Joe, and I have an antibiotic here I'm going to hang for you that he ordered. It's going to run over an hour, and then I'm going to go ahead and we're going to put some sterile dressings on your feet here, okay? Because it's really important that we keep your feet nice and clean. I'm going to go ahead. This antibiotic will run over an hour, okay? The doctor also ordered you an MRI and a couple other tests. You're also going to be getting a bone scan tomorrow. So that's going to require stay. So we're going to be staying the night tonight to get those tests done tomorrow.
Are you serious? She has to stay the night?
Yeah, to get the tests done in the morning, we're going to have to go ahead and stay the night.
This is so ridiculous. This is just nothing but a giant money pit. I'm leaving.
All right, is there anything else you two need?
Give me the keys.
I think so. Go ahead and find.
Bye, Catherine.
Good night.
Bye, Catherine. I'm gonna go ahead and find the other nurse because it's gonna be the end of my shift soon here. So I'm gonna go ahead and go give a report, and I'll be back shortly to introduce your afternoon nurse. Okay? Hey, Rick. How are ya?
I'm good, Nicole. How you doing?
Good. Okay, so I have a lot of information to give you about the lady in room 1.
Okay.
She came into the ER this morning, and apparently she'd been walking around the park about 6 blocks away from home and was really, really confused. Her daughter ended up finding her on the ground and noticed her bare feet, and her feet just looked like they were in bad condition, and decided to bring her in.
Oh, bare feet in freezing weather? What, she got Alzheimer's or something?
Actually, yeah, she does have Alzheimer's. According to the daughter, she has stage 5 as of her last doctor's appointment. I drew her potassium earlier, so you might want to check to see if that's come back from the lab, since it wasn't the last time I checked. We had normal saline running earlier, and I gave her an injection of TPA. I just hung 1 gram cefazolin and 100 mLs of D5W, and it's running at 100 an hour. So it should be down here pretty soon.
Okay.
I gave her ibuprofen a little bit earlier before I did her rewarming process. Dr. Joe went ahead and ordered a rewarming process in the whirlpool for her feet.
Who's that, Dr. Joe?
Yeah.
Okay, cool.
Yeah. He's the one on her case.
He's a good guy.
Yeah. We rewarmed her using a whirlpool, and that seemed to work after about 30 minutes because then I could actually feel her lower extremity pulses. And beforehand, I couldn't feel them at all.
Okay.
Her feet were really like white and waxy looking. Her feet actually turned red. So it was good. I did administer 1 milligram of morphine during the rewarming process because she was in a lot of pain. We've hooked her up to an EKG, and the reading was normal, sinus rhythm on the monitor. She lives at her daughter Catherine's house along with her husband George. I think that you might want to put a consult in with social work.
What was that?
Because of the situation at home. The daughter just left, and I'm kind of concerned and actually completely overwhelmed because I am expecting elder abuse. The daughter just kind of, she stole money out of the mom's purse and everything, yeah. I didn't see any bruises or anything on the patient, but I do think that financially and possibly emotionally she's been abused. And I think that that could be enrolled here.
Well, elder abuse, I'll definitely talk to the social work about that. Sounds like you've had quite the day. Geez, oh man. Thanks for letting me know all that. Let's go check out the computer, see if the labs are in.
All right, great. Hi guys, how are ya? My shift's gonna be over, so Rick's gonna be your new nurse tonight. Rick, this is Ethel, and this is Ethel's husband, George.
Nice to meet you, George. Hi, Ethel. How you guys doing?
Good.
Good.
We'll take good care of you guys tonight. So, is there anything I could do for you?
No, thank you for
Riley?
everything.
Oh, you're welcome.
Hey, Crystal, you got a second?
Oh yeah, no problem.
Hey, patient in room 1, Ethel, the nurse who was giving me nurse report, Nicole, earlier, she was suspecting some type of elder abuse with the daughter, and she thinks the living conditions at home aren't that great, and she actually caught the daughter stealing some money out of the mom's purse when she was leaving. So if you can go in, maybe do a quick consult, ask some questions, see if everything's okay.
Yeah.
Okay.
Yeah, that's no problem. I have some time right now, actually, so I'll go in and ask some questions. And if I figure anything out, I'll let you know.
Oh, perfect. Thanks,
Okay.
Crystal.
Oh, yeah, no problem. Hello. Hi. How you guys doing?
Good.
My name's Crystal. I'm actually from social work here. I just wanted to ask you guys a couple questions. We have Ethel, right? And
Yes.
you're George? Okay. I have here that you guys live with your daughter. Is that true?
Yeah, correct.
Okay. How's that been going for you two?
It's been alright. We lived with her for a while now. When she was in her earlier stages, especially, is when we moved in.
Okay.
It's been getting worse though. It's been a rough transition. Now it's getting a little worse. I think Catherine's just been a little overwhelmed with Ethel's state. And, we noticed some money missing from Ethel's purse a couple times, and we don't know who's responsible or what's happening, but we suspect that it's our daughter, Catherine.
Okay. It's actually interesting that you brought up the money situation. The nurse that was here earlier actually thought that she saw Catherine take some money out of your wife's purse over there. That's actually why I was consulted by your nurse, Rick, right now. So I just wanted to come here and kind of just talk to you guys about some resources that I have for you. Have you thought about maybe like an assisted living or something like that? Do you feel that you are safe with your daughter, Catherine, or would you rather be living somewhere like an assisted living?
I don't know. We're just not sure what to do at this point.
Okay, I can let you know that assisted living, you guys are probably thinking that's kind of like a nursing home, which it is, but you're more independent. You definitely kind of just live on your own, so it would be you two, but there are people that come in, they check on you, they make sure you're taking your medications, they make sure you're meeting your nutrition requirements, things like that. But you are still independent, and you know, you can still have Catherine, she could still come visit and stuff, but things will definitely be looked over and people will be checking on you more frequently. Do you guys have any questions for me?
Not right now.
Okay, well I could definitely print you up some information about different assisted livings around the area and things like that. And I'll let Rick know about what's going on and I'll bring you some stuff in, okay?
Alright, thank you.
Alright, thank you. Hi guys, I'm back. I did some research for you and I did find 3 different places that are in the area. They're close to where you live now. They're all assisted living places, so I'm just going to give them to George here. You guys can look these over, okay?
Thank you.
You don't have to make a decision right now. Just look them over, take your time, and you can let Rick know whenever you're ready and he'll call me again and I'll come back and talk to you guys, okay? But that's pretty much it for now. Do you need anything else? Okay. All right. Good luck to you.
Thank you.
Hello.
Hi.
It's
that. Can one of you be the nurse?
I can't look at you, Hillary. I just can't. Okay.
Put your legs out.
The weather out there.
Oh yeah, it's really sunny, right?
Oh, I'm not quite sure.
Does she have to get the shot? What? Oh, wait, hold on.
You were just like a normal actress.
What's up, Al?
Tetanus is gonna prevent infection. We're just using it as a prophylactic measure, just to make sure she doesn't get any sort of.
I didn't look at Hillary.
I'm Rick. I'm the new nurse taking care of you tonight. You must be Ethel. George.
Hello.
Oh my.
Okay.
Okay.
So
All right.
why is tetanus important? I don't know.